shifting now from patients who have now completed their treatment, a big focus for how we treat patients, and sometimes we forget to talk about it as survivorship, right? What do we do, or what do we recommend once somebody has completed their adjuvant therapy? You know, we do the colonoscopies, we do CT scans at intervals that are probably very individual, CEA exams. But what, you know, our patients always say to us, tell me what I can do to decrease my risk of this ever coming back. How can I change the way I live? So, you know, Heinz, you're in LA. We've got Heinz and we've got Zeb in California. What do the Californians do for wellness after completing treatment?
So I think we have to really focus on what we have data for, because I think one of the biggest stress factors for patients, they go on the internet and they find all these supplements and juices and which cures them from colon cancer. I think there are some interesting data coming out, you know, so that we know the consumption of 2 servings of tree nuts reduce the risk for tumor recurrence. So,
what's a tree nut?
Yeah, so we had this conversation before. I said, it's not a peanut, okay? Yeah. So I think it's all the nuts which grow on a tree, and peanuts do not. They are legumes by definition. So I think that helps. Now, would like to know why that is. And I think there will be ongoing research. We know from the molecular etiology of colon cancer, 95% have wind aberration, which ends up with low vitamin D. So all the patients with colon cancer have low vitamin D. I stopped testing. I don't do it anymore. I supplement everyone. When you believe Kim's data or Jeff Meyer's group data, supplementation of 4,000 units, I give 5,000. They come in a capsule, so everybody gets 5,000 units.
Oh, Dirk's coming at you.
So if you
no, not yet, not yet. And then the question is, you know, exercise. We know 20 minutes twice a week reduces everything.
I say 30 minutes, 5 times a week.
You're much but what I'm saying, that's the minimum,
yes.
which shows the
yeah.
So everything you do which moves your bowel protects, okay? Including coffee, okay? Now, the coffee story is extremely exciting, because when they did the coffee story, it's also a non-caffeine coffee. So it's not going to the bowel movements. Okay, big study in Israel, so they looked how they drank the coffee, and in decaffeinated coffee, it's still protected. So there are interesting things. So coffee, vitamin D, exercise, and nuts.
And diet. and you know, diet, I mean, certainly in that there's probably the
no red meat.
Adhering to a so-called less saturated fat or more Mediterranean diets. I mean, there's pretty good data now for that would certainly benefit patients. And as Heinz will tell you, in Los Angeles, we have a lot of healthy vegan eaters. So it's not necessarily always relevant for our patients, but globally, I certainly think dietary adjustments are one thing that we can advise every patient to do.
The most important risk factor is obesity, across all tumor types, and it's also true in colorectal cancer. And we have to, let's say this is all, let's say, grabbing each other's hand, because eating less, eating healthier, etc., prevents you also from obesity, and so things are not to be seen independent. For me, I would doubt whether it makes sense. This was my point, to have an intake of vitamin D, because otherwise, if you have all low levels in California, this means no one should live long after recurrence of colorectal cancer living in California.
But it's a prognostic fact we know already, and when you supplement, the patients live longer. So there are multiple data sets which support the role of vitamin D. Now, in the prevention, the data sets are much lower, that is going on, but in metastatic disease, it's shown the sunshine. You know?
They had a randomized phase 2 study.
Phase 2, for the PFS was longer. So, but I wanted to go back to the food, red meat. I love this story. So red meat consumption, and you've already mentioned by Steph and Dirk, matches the incidence of colon cancer in the world, with 2 exceptions. One is the Mongolai. And what do they eat in the Mongolai in Nepal? The yolk. This animal with long hair. It's red meat, but it does not increase colon cancer risk. So a lot of, Harald von Zuhausen, Nobel Prize winner for virus-induced cancers, thinks it is related to the cow, the real cow at red meat. and not necessarily, for example, the pig or something else. We don't know, but that are a lot of different hypotheses, but I found this data amazing. Then there is like a gazelle type in Ecuador, in South America, with the long horns. They also don't increase, also red meat don't increase colon cancer. So, you know, it's interesting.
So our recommendtion now is exercise, tree nuts, and
Mongolia.
vitamin D, and yak meat. We'll see the incidence of yak farmers.
We'll now see a surge in the gazelle industry.
And really quickly, aspirin. We have been back and forth about aspirin, taking a baby aspirin, special patient populations with colon cancer. You know, Dirk, what's your thought? Do you recommend patients take a baby aspirin?
Well, say data are difficult to interpret. We have strongly supporting data. We have other data which show that there is no benefit, or there are maybe subgroups. We had the discussion on PI3K. We had the discussion on Lynch patients, etc., whether they would benefit from this. Personally, my interpretation of the data, and this bringing it into the core recommendation, is for Lynch patients, I do clearly see a role. For others, I do not see a role.